All right. Good morning, everyone. Fun morning. Thanks for everyone for joining. Let's get started. Welcome, Rebecca. Sorry, Elizabeth. It's all good to go, right?
This is a moderator. Yes, ready to go. From
All
my
right.
end, at
Thank
least.
you. Awesome. Welcome to the October 18th, 2023 Licensing Committee meeting. My name is Song Oh, Chairperson of the committee. Before we convene, I'd like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law, where protection of the public is inconsistent with other interests sought to be promoted. The protection of the public shall be paramount. As I facilitate this meeting, I will announce when we are accepting public comment. I have advised the meeting moderator to allow 3 minutes to each individual providing comments. We will begin with public comments for individuals attending in person, if any, followed by public comments by individuals participating via WebEx. This approach is necessary to facilitate this meeting. Before we get started, I would like to ask staff moderating the meeting to provide general instructions on the process for providing public comment via WebEx. Moderator?
This is the moderator. Each time public comment is requested, I will open the Q&A in WebEx and I'll display the instructions on the screen in which you can participate by clicking on the hand outline, which is at the bottom center of your WebEx screen, or by clicking inside the text box of the Q&A. Thank you so much. There, the instructions are on the screen. You can click on the question mark inside of the square, typically lower bottom right corner of your WebEx screen if you're using the app, and you type the word comment in that text field and make sure it goes to ask all panelists before you click that send button. And again, a reminder, you can click on the outline of a hand, typically bottom center of your WebEx screen. For those who are calling in, you can raise your virtual hand for us to call on you if you press *3 from your phone. And then to unmute yourself for those calling in, *6, it will prompt you how to unmute yourself. And for those who are logged in, you'll have a pop-up screen that asks to unmute me. And that'll be it. I'll turn it over to you. Thank you.
Thank you, moderator. I would like to take a roll call to establish a quorum of the committee. Jake Patel.
Present.
Good morning, Jake. Renee Barker.
Licensee member present.
Good morning, Renee. Trevor Chandler. Don't think Trevor's joining us today. Jesse Crowley.
Licensee member present.
Good morning, Jesse. Jason White.
Public member, good morning, Sung.
Good morning, Jason. And I'm here. A quorum has been established. Members, we have a very full agenda for our meeting today. As everyone participating today to be respectful of the work before the committee. We encourage participation by members of the public throughout our meetings at appropriate times. The committee respectfully requests that when comments are provided, they're done so in a professional manner consistent with how the committee conducts its business. Moving on to the next agenda item 2, public comments for items not on the agenda. I will now ask the moderator to open the line for individuals to provide public comment, provide the opportunity to provide public comment. You're not required to identify yourself, but may do so. I would like to remind everyone that the board cannot take action on these items except to decide whether to place an item on a future agenda. Members, following review of the public comments, I'll ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the committee and members of the public to request consideration of an item for future placement of an agenda, at which time discussion may occur. I confirm there's no public attending in Sacramento, so just want to confirm that.
That's correct. No public members here.
All right, if you could please let us know if that changes, and as the day goes on, that would be great. We'll now open the public comment for WebEx.
Moderator, the Q&A is now open, and just a heads up, the pharmacy video feed is displaying someone's computer. So the instructions are on the screen for your reference, those who are logged in via WebEx. If you would like to participate, again, click on the question mark inside of the square, type comment, send it to all panelists. For those who are calling in, press *3 to raise your virtual hand. So I'm going to call on Jackie Stover. I'm going to set my timer for 3 minutes. I'll provide you a 10-second warning, and I am sending a request to unmute your microphone.
Do you hear me?
Yes.
Okay, thank you. Hi, my name is Jackie Stover, and I am a specialty pharmacist. I wanted to take this opportunity to say thank you to the Board of Pharmacy for including remote processing in today's agenda. I also wanted to bring to your attention some things that I have personally witnessed since returning to the office at the specialty pharmacy. The pharmacists who have had to quit have been replaced not by other California licensed pharmacists, but rather by out-of-state pharmacists who are able to work remotely within their own states. This is concerning because these California pharmacists had to leave their positions as specialty pharmacists, which, by the way, required long and extensive training due to long commutes and no compensation in pay, all despite the increased cost of living. Additionally, new pharmacy graduates' options for job replacements may be further limited with the outsourcing of jobs to out-of-state pharmacists. Number two, increased occurrences of contracting COVID-19 and other illnesses, resulting in more call-outs, being short-staffed, and consequently negatively impacting the delivery of optimal care of our patients. Working remotely can dramatically reduce the chances of these incidents. And finally, number three, specialty pharmacists, specifically front-end duties, include non-patient facing, phone handling, data processing, and no medication handling. The 3 years of remote processing during the pandemic have demonstrated the numerous benefits, primarily to our patients. For example, faster turnaround time for life-saving medications with the elimination of time spent commuting on-site to access the computer system. HIPAA was a non-issue since the desktop computer systems were connected via VPN. So finally, I am convinced that with the ever-changing technology of telehealth and AI, it is inevitable that new legislation will be written to reflect those changes for the profession of pharmacy. I am requesting that the sooner specialty pharmacy is included in the discussion of remote processing, the better it will be not only for our patients, but also for the growing field of PBMs and the profession of pharmacy overall. So thank you and have a great day.
Thank you for the comments.
Moderator. Next individual, Richard Dang, I'm going to send a request to unmute your microphone. I'm going to set my timer to 3 minutes.
Taking public comment. My name is Richard Dang, and I'm attending on behalf of the California Pharmacists Association. I'd just like to take this moment in the public comment to provide a brief legislative update on some items that are of interest to the Board of Pharmacy. AB 317, which was sponsored by CPHA and supported by the Board of Pharmacy, was passed by the legislature and signed by Governor Newsom. AB 317 was the bill that would require health plans to pay pharmacists for pharmacy services that are within their scope of practice and that are currently covered for other healthcare providers. So we are very excited about the result of that outcome and wanted to provide that update as the board was a supporter of that bill. And then the other one is, as you may know, AB 1286, which was sponsored by the Board of Pharmacy and supported by CPHA, was also passed and signed by the governor as well. And that one was a very large bill encompassing a variety of multiple topics that I'm sure will also be mentioned later today, including protections for PIC authority, medication error reporting, and pharmacy technicians administering vaccination, and some discussion on tech ratios within that as well. So thank you for allowing me to make public comment and look forward to the meeting today.
Thank you so much, Dr. Dang.
And this is the moderator. I do have Nick Mesa. I will send a request to unmute your microphone. Yes, we are commenting on non-agenda items for now. Let me find your name in the list if you give me just a moment. I've sent a request to mute your microphone.
Thank you so much. I just wanted clarification on our ability to comment. Our comments really are in relation to the central fill discussion, so I will hold until then. Thank you.
Thank you. And this is the moderator. I do have a call-in user 11. I'm going to send a request to unmute you from my end. *6 to unmute yourself from a phone.
Hello there. Can you hear me okay?
Yes, we can.
Perfect. Thank you. My name is Cindy, and I'm here today to lend my support to allow remote processing for specialty pharmacists. I personally drive over 110 miles to work daily to serve my patients as a pharmacist at a job I enjoy. As you may all know, finding a job that one enjoys isn't easy in our field. However, that love is being chipped away. With the cost of commuting and living on the rise, the mental and physical stress of driving the LA freeways, and quite honestly, the increased cost of keeping a pharmacist's license, there is not one day that I don't think this is all worth it. My story is not unique. There are a lot of us out there doing the commutes, but we are thinking of giving up on our jobs and even our profession. So I implore the board to allow remote processing to expand to specialty pharmacists so we can effectively serve our patients without the added stresses. Thank you very much.
Excuse me, this is Corinne Gartner, Board Counsel. I'd just like to remind everyone making comments during this public comment period that this is for items that are not on the agenda. If you do have comments related to agenda items that will be discussed during the meeting, if you could save those for those items, that would be appreciated. Thank you.
This is the moderator. I have individual call-in user 12. I'm going to send a request to unmute your phone. *6 to mute yourself from a phone.
I'll just refrain from making comment right now to the agenda. Thank you.
Okay, this is the moderator. There are no additional requests for public comment. Would you like me to close the Q&A?
Yes, please. Thank you, Elizabeth. Thank you, everyone, for their comments. All right. Members, any comments on it? I think we're ready to move on, but just want to make sure. Okay, seeing none, moving on to next agenda item 3. Approval of July 19th, 2023 committee meeting minutes. As we begin our discussion, I'll ask members if they have any questions or comments on the draft minutes from July 19th, 2023 meeting. I would also entertain a motion if you believe such action is appropriate. Members?
This is Jesse. I do have a clarification on one of the meeting minute items. Let me see. On page 9, paragraph 3, starting with Member Crowley, it said Member Crowley agreed with Dr. O and Mr. Patel. I just wanted to clarify that I did agree with the concept that Jig was saying in terms of a out-of-state licensed pharmacist probably has more training and maybe more reliable than an unlicensed clerk in California because there's such little training to become a clerk. But ultimately, I do agree that for now that the any remote processing work should be done by a California licensed pharmacist. I wanted to just clarify because I think there were multiple pieces that Jig was talking about. So if we could just adjust the minutes to reflect that, I think that would be good.
Sure. I'm hoping that that could be incorporated into the motion. If you would like to make a motion, if you'd like to make motion with that, that would be something that we could definitely figure that out.
Okay. Yeah, I'll make the motion.
Awesome. Anyone second?
I'll second it.
Thank you, Jake. Corinne, Ann, are we good? Did we capture that?
So as I understand it, the motion is to approve with clarification to page 9, paragraph 3. And then I have that in my notes what the change will be. if that's
Okay, well,
sufficient.
and-
And we're happy to run it through Member Crowley before we finalize to make sure we've captured her comment appropriately.
Corinne, is that
Thank you.
sufficient?
Yes, I believe so.
All right, thank you, Corinne. All right, with that, any other comments, members? Sounds good. So, moderator, please open the line for public comments.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. For those who just logged in, the full set of instructions here. If you would like to participate, click on that question mark inside of the square, typically located bottom right corner of your WebEx screen, and the text field that appears, type the word comment and make sure it asks all panelists before clicking that send button. For those who are calling in from your phone, you can press *3 to raise your hand and we will call on you. And at that point, *6 to unmute yourself. So *3 to raise your virtual hand from your phone. At this time, I have one request for public comment, calling user 12. I'm going to send a request to unmute your microphone. I'm going to set the timer for 3 minutes. Request has been sent.
Hi, my name is Dylan. I've been a pharmacist for 10 years and I've been working from home for the last 3 years. I'm here to make a comment about work from home and remote processing. I strongly urge the board to.
So sorry. I'm going to stop you. This is regarding the minutes. Agenda item 3. But we're going to go to that probably in the next agenda item. We have to adhere to the agendized items discussion and public comments. So if it's related to the minutes, approving minutes
My
from
apologies.
the July 19th, 2023 committee meeting minutes, we are opening public comment for that. If you are not, please, we are going to have that agenda item coming up very soon. So if anyone is here for the minutes, for the agenda item 3, please make public comments.
This is the moderator. Call-in user 15. Call-in user again, a reminder, this is for public comment on the meeting, on the agenda's meeting minutes. I'm going to send a request to mute your microphone. You have 3 minutes.
Hi, this is Preeti Patel. I'm sorry, I will wait until the agenda will come up for the remote processing. Thank you.
This is the moderator at this time. No further requests. Would you like me to close the Q&A?
Yes, please. Thank you, Elizabeth. All right, with that, we'll go for vote. Members, Jig, how do you vote?
Yes.
Thank you, Jig. Renee, how do you vote?
Yes.
Thank you, Trevor. How do you vote? I'm sorry, Trevor is not here. Jesse, how do you vote?
Yes.
Thank you, Jason. How do you vote?
Yes.
Thank you, and I vote yes, the motion passes. Okay, next agenda item is agenda item 4, discussion and consideration of provisions for remote processing. All right, you may recall we have discussed remote processing over the several meetings, including, well, this has been more than several meetings. It's been discussion for quite a while, including during our January meeting where we considered several policy questions and received significant public comment in support of making permanent provisions for remote processing for pharmacists working in hospitals and community pharmacies, while other comments expressed concern with the board taking such action. More recently, as part of our April meeting, we reviewed what could be a possible legislative framework. However, we did not have a quorum. No recommendations were offered from that discussion. Also, there was significant public comment, and there did not seem to be a consensus at that time. With that in mind, we attempted at different ways of approaching the subject in July, and more recently at the July meeting, I believe we reached some consensus on a few items and made it possible for us to develop a legislative proposal that could have support of the committee today. Just as a quick reminder, related to this issue, during the February board meeting, the board voted to sponsor legislation to make permanent limited provisions related to remote medication chart order review for inpatients. These provisions are included in Assembly Bill 1557, which was signed by the governor. As I open this up for discussion, I would like to confirm that members received the written comments related to this agenda item as well. As I have previously stated, this is a complicated issue. The services pharmacists provide vary greatly, as do their work environments. Thank you very much to all of the stakeholders that have provided feedback during all of our prior meetings. Your input is very important as we consider this issue. As noted, the committee and board need to determine what is best for consumers consistent with our mandate. Based on our discussion during the last meeting, I worked with staff to develop a legislative proposal that I think could serve as an important first step to expanding remote processing in all settings. The proposed language is an attachment 2. Before I open up for discussion, I want to highlight the approach being offered. First, it will provide the board with the authority to waive both provisions of pharmacy law, both provisions, statute and regulation, to allow for research and study into new and innovative methods for drug handling under specified conditions. I believe this is appropriate to ensure the board has means to allow for research into the use of technology, for example, under this auspices of the Accredited School of Pharmacy. Such an approach would allow for evaluation of changes in a controlled, research-driven environment, to allow for future decisions of the board to be made based on some data. Second, the language provides the board with explicit authority to adopt regulation to establish provisions for remote processing beyond those currently allowed, establishing explicit authority for the board to promulgate regulations in this area will allow the board to respond more nimbly to conditions as they change and to respond to findings of research through a public rulemaking process. With that in mind, members, do you have any questions or concerns with the language and approach offered? I'm sure we have some comments, and looks like there's significant public comment that we're going to be expecting, so we might also just hear from all. But if there's some consensus, it may be more efficient for us to have a motion and second before we open up for public comment as well. But we're gonna kind of get members' thoughts first to see where we are. So members, share your thoughts. Let's open the discussion. Let's start with any additional conditions that you believe would be appropriate to detail out in the statute as opposed to via regulation process. To me, language establishes an appropriate minimum standards without being overly prescriptive. This has been a long road to get to this point, to balance both the concerns that were raised throughout the last many meetings we've held, legislative reality of what is going to be extremely still a hurdle to go through. And I think that we are close to landing in some spot where we could land. This plane has been flying around the circle with the oil is running low for like 2 years. So I think hopefully we can land somewhere. With that, Jesse, I see your hand is raised, so go ahead.
Thank you, Sung. I guess I just wanted clarification just on what exactly we're commenting on, or do you want just general comments as a whole or specific to the proposed language?
I think both is fine. Yeah, both. Absolutely, because this is going to be, I think, a little bit of a lengthy item anyway. So go ahead, Jesse. I think we're going to just.
Okay.
Yeah.
I definitely, I think, want some more insight and perspective from, I guess, Jason. I would have said Trevor as well, just on the language and seeing realistically if it's too broad, if we think that the legislature might think that this gives the board a little too much authority by promulgating its own regulations. As a whole, though, I think the consensus that I've gathered is that the majority of the board, from what I understand, agrees that there's definitely some remote processing benefits specific to specialty pharmacy. And so I'm wondering if I don't know if simultaneously with this, but if we can kind of work on something at least focus on that because I think that that's a pretty urgent issue and I think one that keeps coming up over and over again that we all kind of see benefit from. So I wanted to kind of start from there.
Sounds good. What are your thoughts on the language proposed, Jesse? Do you think that, I mean, I guess Jason can comment on that, but.
Yeah, I think I wanted to hear kind of more feedback on what Jason thought of the language.
Hi, yeah, happy to chime in here. And unfortunately, Jesse, I really can't go and offer any kind of clarification on what the legislature is going to do. You know, they are independent elected officials with their representation being towards their constituents. So I think we do have some flexibility in here. Personally, I think that what we're offering up does suit our needs. We have spoken to this issue many, many, many times. I think it's important for me to go in here. We have a lot of attendees from the public here to gather their input, but I think we have been round and round and round on this issue, and this is about as close to consensus I think as we have got. But regarding the language in the legislature, it is unpredictable, but I think this would suit our needs going forward right now.
Great, thank you, Jason.
All right, go ahead, Renee.
Hi, thanks. Yeah, I appreciate those comments, and I support the language the way that it's written. I feel that there's opportunity to not be prescriptive, and yet still determine possibly which areas. I mean, certainly specialty has been discussed, and I am sure that there are others or will be others. And I think it keeps it open to allow the rapid change of pharmacy, and in terms of remote processing and locations that are don't have space for people, but they're growing, or I mean, I'm sure there's a myriad of reasons, but I just wanted to say that I certainly for section F support that broad, like just defining that there would be some safeguards for PHI and record keeping requirements, and then also for the pharmacist in charge. So I'm not as aware of the types of opportunities in as written in E, but it does have a lot of safeguards there in terms of having to be reviewed and approved before they can move forward with something like that. So overall, I'm in favor of what's already written.
Thank you, Renee. Jake?
Thank you, Sung. Well, I feel that there should be explicit authorization for all community pharmacists to do remote processing, regardless of if they're licensed in California or not. Given the working conditions, recent consolidations of retail pharmacies that have made some headlines, I'm really concerned about the workload in pharmacies and how a remote pharmacy processing really helps take care of some of the tasks that can be done remotely. And it's a blessing. And putting some of the requirements like licensed in California, it's going to be a hurdle in workflow, not just in specialty setting, but in community setting where majority of the prescriptions for consumers are filled today. You know, especially during this busy season where immunizations are at its peak, remote processing is a blessing. And removing some of these hurdles is going to be important, especially the requirement of somebody licensed in California. So, sorry about the earthquake warning. Sorry about that. But anyway, those are my thoughts. I know we have discussed this before, but I recommend that we remove the language where it has to be a California licensed pharmacist. It's going to drastically help with this whole working conditions that, we had all the ad hoc committees and all the other regulations that are coming out of it. Putting this barrier, it's kind of like fueling fire to workplace condition. So we should remove that. Thank you.
Thank you, Jake. Thank you for the comments. Jesse?
Hey, son, I'm just gonna need a minute. I'm having a little trouble with my audio, so if there's someone else who has a comment.
Okay, that's good. Yeah, I think that this language was developed with a lot of balancing act. So I think this is a good starting point. We'll try our best to see where we can take it to legislators and also, well, before that full board.
Mike,
So
Mike, sorry if I can interject. My only question to the board members is, are we really helping working conditions by putting a limitation? Are we?
that is a good question. I just think that to me, there's a huge value in having licensed California pharmacists working. There's so much California law that is unique and challenging in so many ways, that I'm just not comfortable opening to any licensed pharmacists with all their different state rules and regulations that really has so much variances. So that's where I am. But I can completely understand your thoughts there, Jake. I
My,
understand.
my thing is, this is going to worsen working conditions, and it's something that could be changed by changing the language right here, right now. I mean, before we put it in front of the board and to legislators, because it's crucial. I mean, why go backwards? That's my question.
But I think there's so
Going
many
backwards.
pharmacists, California licensed pharmacists who's willing and able to step in and help out. I think they're just well-educated, licensed California pharmacists who are more than happy to work and help out if this opportunity arises. So
We have some of the most amazing institutions that produces pharmacists in this country, accredited, and they are practicing. They're serving millions, hundreds of millions of other Americans. And if this pharmacist can be helpful to Californians, I don't see any issues with that. Given the fact that today I can hire a Starbucks clerk, put him in my pharmacy, 2 days of training, and they can type a prescription. Again, I think this is going backwards. We should remove that requirement of them being a licensed pharmacist in California.
I hear you. Jesse, are you ready for your comments?
I am, thank you. Sorry, I'm having a problem with my earpods. But it looks like I'm back. So I agree with you, Sung. I think it should be a California licensed pharmacist. Jig, I totally hear you. And I think part of that problem, though, has more to do with the training at each individual company than it really does the process itself. A clerk should be getting more than 2 days of training before they're helping in the pharmacy. But that's the unfortunate reality, that the training isn't as extensive as it should be. Ultimately, though, there are plenty of pharmacists in California who need work. We have an abundance of pharmacists willing to work. And I think we should focus on that specifically because they know the requirements in California. Just going to use as an example, we have a pharmacy that does assist with busier pharmacies for the company I work for. They have a non-resident license. And I've had a pharmacist recently tell me that they were performing consultation, and through the consultation, they realized that the prescriptions, 3 different medications had been typed up for the wrong patient. And they didn't notice until consultation I mean, they're fortunate they even caught it because you don't get the hard copy when you're counseling patients with most of the systems that exist. So that pharmacist was diligent enough to go back and look through everything and realize the error. There's also just like an issue of liability and how the board can even kind of figure out if we're going out of state, where does the liability lie? How can we actually hold out of state pharmacists responsible for certain things like medication errors and whatnot? I think leaving it specific to California pharmacists kind of alleviates some of that. And just kind of a side note, because I know that Jig did touch upon this, I do want to highlight all of the walkouts that we've been seeing across the country specific to retail pharmacy settings. And some of the states included Kansas and Missouri. They have similar guardrails that we've been discussing the last few meetings in terms of their remote processing or the ones that they're proposing. I believe Kansas still has their remote processing proposition in their comment period. I think just generally though, for ease of enforcement, having a California licensed pharmacist just makes a lot of sense.
It's not about how easy it is for the board to enforce. It's about consumers. It's about the workload, and especially in our pharmacy deserts, the areas where we don't have that many outlets. It's a disaster where you cannot get somebody out there due to sickness or anything like that. And you can support those pharmacies really well if there is a remote processing. And, Jesse, yes, errors can happen in any setting, whether you're a California licensed pharmacist or non-California licensed pharmacist. A proper QA process has to be in place. Dispensing pharmacist who is providing consultation should have the hard copy and everything else in front of them. These are California pharmacists. But all the clerical work could be done remotely, and it does not require a California licensed pharmacist. I don't get it. I mean, our consumers can benefit from this. We can reduce all the issues of working conditions where there are not enough people, not enough help in the pharmacy. And to the point where you say that there are California pharmacists out there looking for jobs, look at the school enrollments. This year's enrollment for California Pharmacy School is lowest, and it's lowest in the United States. I mean, I don't have the exact statistics, but it's true. And we have to not only look at 2023. Our job as committee members and board members is to look at how our actions will influence the years to come. And I'm really concerned about some of our remote locations and pharmacy deserts within urban regions for access, and we should remove this. I feel that is the most responsible thing we can do as committee members, as licensee members, that know exactly how a pharmacy runs. Thank you.
Thank you, Jake. I think that so we'll probably best to hear from. I'm a little afraid that this is okay. Well, we'll see. I think let's open up for public comment here to hear from what some people have to say. And we'll see where we can land. I'm hoping that we can land somewhere today, but we'll see. So let's open up for public comment. I think this is gonna be a hot topic, so it's a lot coming up. So before I go to WebEx, and still no public comment in Sacramento, correct? Just want to make sure. All right, thank you. Thank you. Moderator, please open the line for public comment on remote processing.
Moderator, the Q&A is now open. The instructions are on the screen for your reference. Since we have people logging in, I will go through them again. Click on the question mark inside of the square, typically lower right corner of your WebEx screen, and type the word comment in the text field and make sure it goes to all panelists before you click send. For those who are calling in, press *3 from your phone to raise your virtual hand. And if you can please submit either, if you're logged in, if you want to raise your hand or send a comment through the Q&A, but I get a little bit confused if they're doing both. So if you can please do one or the other, but I will get to each and one of you. If you can please be patient with me. I will start with calling user 12. I'm going to send a request to unmute your microphone. Just a reminder, from your phone, press *6 to unmute yourself. So I'm going to send a request to unmute your microphone, calling user 12. You are
Morning.
unmuted.
Thank you. Thank you, the board, for allowing me to voice my opinion. Thank you for your time. My name is Dylan. I've been a pharmacist for 10 years and I've worked from home for the last 3 years. I strongly urge the board to consider allowing specialty pharmacists to continue or resume working from home. And here are some of the things I want to share with the board. As a pharmacist over the last 10 years, I've witnessed the stagnation and deflation of pharmacist wages while battling extremely high student loan payments, increased inflation, as well as gas prices. But most important of all, decreasing the time we have for our friends, family, as well as improving our work-life balance, which would ultimately benefit our consumer. Because at the end of the day, pharmacists are compassionate and caring people, and we love to help our patient as well as spending time with our friends and family. If other states in the nation can find a way to make remote processing and work from home work, why can't California? I love the state of California because we are usually the avant-garde, the state that leads the nation in the fight for environmental protection, work-life balance, worker protection. And when I mentioned worker protection, some of the board members brought up about other pharmacists from other states working for us. While it's true that that would open up the worker pool, but pharmacists from other states doesn't have to, most of them doesn't deal with high housing prices, cost of living, and because of that, their wages are lower. And so in a way, this will outsource pharmacists' job to other states and not protecting us and not allowing us to serve our patients. So I think it's time for us to step up and protect our patient as well as the pharmacists that help serve these patients. Thank you for your time and consideration.
Thank you for the comments, Dylan.
This is the moderator calling user 15. I'm going to send a request to unmute your microphone. *6 to mute yourself. And again, I'm going to set my timer to 3 minutes. You're unmuted.
Hi, this is Preeti Patel. I'm a California pharmacist working for specialty pharmacists since December 2013, and I'm here to support remote processing for California pharmacists. My job as a specialty pharmacist is a clinical management of patient complex therapy, but it does not involve any dispensing. We do not physically handle the medication and therefore do not need to be on site. We do our work through secure computer system, which can be also do remotely without compromising patient safety and health, and take care of the patient's need the same way working in the office or a pharmacy. We have done this for last 3 years till May 2023 for a pandemic. I love my job as a specialty pharmacist and enjoy taking care of my patients. And I drive total 60 miles to work every day. Not having to drive to work had allowed me to work longer hours which has helped alleviate pharmacist shortage and help our patient. We can help environment and safety of Californians by working remotely. Technology has evolved and it has provided us the ability to work remotely, and many other states are allowing their pharmacists to work remotely and are already working from home. And are like reviewing California pharmacists' order, which put risk of California pharmacists losing their jobs to other state pharmacists. If it's not safe for California pharmacists to work from home, then not sure why the other board of pharmacies are taking care of California patients. Thank you.
Thank you for the comments.
This is the moderator. Next individual identified as calling user 19. I'm going to send a request to mute your microphone. Remember, *6 to unmute yourself. I'm going to set my timer to 3 minutes. And you're unmuted.
Hello, my name is Thomas. So I'm here to also add that support for the remote processing. I believe allowing remote processing will provide flexibility to pharmacists, and this is important, and because it will benefit patients. California is a big state, and there are many rural areas need the presence of pharmacists, including pharmacists practicing a specialty setting as well. With remote processing, we can provide our high standard of care to patients anywhere in California, even as on-call or emergency situations. And I believe the flexibility in pharmacy practice is very important, and it will benefit our patients. Yeah, thank you so much.
Thank you for the comments.
This is the moderator calling user 28. I'm going to send a request to unmute your microphone. Again, *6 to unmute yourself. I'm going to set my timer to 3 minutes here. And calling user 28, I sent another request to unmute your microphone. Okay, again, this is the moderator calling user 28. I'm going to send a third request to unmute your microphone from my end. And when I send the request, it's going to prompt a verbal notification on your end from your phone to unmute your microphone by pressing *6. So I'm going to do it one last time here. There you go. Calling user 28, you have been unmuted. I'm going to set my timer to 3 minutes.
Hello?
Hi.
Can you hear me? I want to make sure
Yes.
I'm. Okay, my name's Frank Briganti. Been a licensed pharmacist since 1965. An area that Newlands needs to look at, and I've been trying for 2.5 years through the board, is retired pharmacists. There's a pool of us out there, but it seems now with the fee increase to $533 a year, 2 years, I wasn't able to renew it because of financial needs and being retired. So it seems to be that this fee is set by the legislature, and I've been all the way to the governor's office trying to figure out who's in charge. But you have a lot of retirees out there that could be practicing if you would just take a look at the fee structure for renewal of your license and still continue with the continuing education and be in good standing with the board. For example, in the state of Nevada, which I'm licensed, after 50 years, and I have served 50 years and got an award from the State Board of Pharmacy in California, I was able to waive my renewal for my license in the state of Nevada, and also it's also in the state of Arizona. So there's a pool of us out there except for finances, can't renew our license, and there's a good avenue to go. So, speaking with that, we need to open up to those that are qualified, have passed their state boards in other states, are accredited pharmacy schools, continue with education, and in good standing with their state boards. I think it's important to look at, please. Thank you.
Thank you for the comment.
This is the moderator. Next individual identified as Inez Anton, I'm going to send a request to unmute your microphone. And you're unmuted.
Hello, can you hear me?
Hi, yes, we can hear you.
Okay, thank you so much for giving me the opportunity to comment. My name is Inez Anton. I'm a California registered pharmacist for 10 years, and I want to echo the comments of Jackie Stover, Cindy Wong, Priti Patel, Thomas Kim, Dylan Lee. We all work as a specialty pharmacist, and as been said earlier, we work for front end. So our duties include non-patient facing, phone handling, data processing, consultations with no medication handling. And for the last 3 years, we've been able to work remotely without any HIPAA issues. Although we witness that the patients benefit a lot from this, especially faster turnaround time for life-saving medications like hemophilia medication, sickle cell disease, cancer medications, and genetic disorders. So I really hope the board take this in consideration, and thank you so much for listening to my comments.
Thank you for the comments.
Next individual, Mukesh Modi. I'm going to send a request to mute your microphone and set my timer to 3 minutes. And thank you everyone who's raising your hand and submitted comments. We will get to you. And Mukesh, the request has been sent. You're unmuted. I see the audio got disconnected. And disconnected again. So Modi, I'm going to send a request to unmute your microphone. And Mukesh, you might still be able to hear me. At the top left corner of your WebEx screen, there's tabs. There's File, Edit, Share, View. The fourth one is audio and video. If you click on that, the drop-down menu, select the switch audio, and you can call in, but still keep your WebEx running from your computer. I'm going to try it one more time to see if unmuting will work. Otherwise, I recommend connecting your audio through a phone. Chairperson, shall I move on to the next individual?
Yeah, we can try to come back to Mukesh Modi later on. We'll try that again. I think there's a lot on the list, so let's move on and then we can come back.
Next individual, Nicole Cover. Nicole, I'm going to send a request to unmute your microphone. Are unmuted?
Can you hear me?
Yes, we can hear you now. Thank you.
Okay, perfect. Thank you for your time this morning. I just wanted to echo, I'm Nicole Cover. I'm a past member of the Michigan Board of Pharmacy where I served 8 years and I was chair for 6 of those years. I've went through a lot of this in our state and I serve some of the states, Missouri and some of the areas that you guys are mentioning. And a lot of them don't require licensure as long as you are in good standing within the license state that you were, originally licensed in or that you're currently licensed in. There's also an option of a credential through NABP Verify, which North Carolina did for several states where they're monitoring the discipline, making sure that you're getting a pharmacist that hasn't had any issues or, because you can have a good California pharmacist. You can also have one that happens to be licensed that isn't in the right role. And really what our charge is to protect the public health in all 50 states. And so I think just looking at what works for you based on who you have licensed or you have an abundance, we have an abundance of teachers, but they don't want to teach. And so I think we have to look at getting people that what they want to do. Those California pharmacists might have a patient that resides in Michigan. We wouldn't require them to be licensed, but by your rule, they could have to get licensed in 48 other states. I think you're looking at creating an occupation instead of a profession. We're looking at nurses and doctors that are not doing this. They're not requiring it from state to state. They're looking at compacts. They're coming up with professional solutions and recognizing themselves as professionals. And so I really encourage you to kind of look deep within, and just based on numbers doesn't mean that you're going to have people that want to do those roles. And I also wanted to give you a number, Dr. Patel. It is about 43%. The enrollment is down across all schools. And I know Michael Hogue now with APHA, looked at his California school, gave us numbers there. So it's not just in California, it's nationwide, and the numbers are dwindling, and we need to make sure that we're looking at that from a bigger lens. Thanks for your time today.
Thank you for the comments.
This is the moderator. Next individual identified as Richard Dang. Richard, I'm going to send a request to unmute your microphone.
Thank you. Hi, Richard Dang on behalf of the California Pharmacists Association. Just wanted to provide comments on the proposed language of the legislation that was discussed today. We would support the idea of the limitations of having licensed California pharmacists and pharmacies included as a part of that. I listened to the discussion from the committee members, and I would like to add the perspective that in the last few years, this board specifically has worked very hard to address workplace conditions and implemented several regulatory and legislative changes to protect and improve workplace conditions, most notably with AB 1286 that was signed this year. And so, allowing remote processing to be outsourced to other states where these same workplace condition protections are not in place would be undermining the work that you did as a board in order to support California pharmacists and the workplace conditions that they are experiencing here. So I would be concerned about allowing companies to outsource remote processing to other states where these same protections are not in place. With regards to access to rural communities within California, my understanding would be that if there are companies with remote processing facilities or employees in other areas within the state, that they can support those areas that are in rural areas or that have pharmacy deserts. So there are other areas within the state that can support those areas that have a shortage of those employees. And my final comment was more of a question and maybe just a personal clarification. And when you're talking about remote processing in the language, are you referring to verification or data entry, or are you referring to both? In which case, if you're referring to both data entry and processing, I think to the point of limiting it to pharmacists, you might want to consider expanding it to also technicians to have that ability. Obviously, if it's verification, that should be limited to pharmacists only. Thank you.
Thank you for the comments, Dr. Dang.
Next individual, Vincent Sharon. I'm going to send a request to unmute your microphone. I apologize if I mispronounced your name.
Can you hear me?
Yes, we can hear you.
Okay, thank you. And you said my name correctly. Thank you as well. I work at CVS, which is a community pharmacy setting. So my comment is regarding that setting for remote processing. Honestly, remote processing, from what I could tell temporarily that went on during COVID, was it just reduced pharmacist overlap. in the pharmacy. We did just pass 2 historic pharmacy safety bills, you guys did, and we should see the results of those on the working conditions instead of trying to rush this remote processing through, which undermines or belittles what we just passed. Although Premshov CVS says technology advancements will not result in the removal of hours, nothing, unless it's written down or it's law or passed by you guys, it's not permanent. There is no shortage of California licensed pharmacists, as even right now at CVS, all my pharmacists in my region still cannot get the hours that they need to even get near 40 hours. Because like every technology advancement that happens in community pharmacies, that only just means that hours will be optimized, labor will be optimized, which means just less pharmacists overlap and more for pharmacists to do on their own. I think you guys maybe should consider, at least for the community pharmacy part, before rushing this through, that you should have a confidential survey for community staff pharmacists and see how they really feel about remote processing. Thank you.
Thank you so much for the comments.
This is the moderator. Next individual identified as Keith Yoshizuka. I'm going to send a request to unmute your microphone. Request has been sent.
The opportunity. Keith Yoshizuka, California Society of Health System Pharmacists. I support the comments made by Dr. Dang, and I speak in opposition of the proposal made by Board Member Jake Patel about allowing non-California licensed pharmacists to engage in remote processing. This would compromise the board's ability to protect the public in the event of a violation of law by one of these pharmacists not licensed in California. The California Board of Pharmacy would have no direct jurisdiction over these individuals. And I think that it is important that the board have that authority in order to maintain the protections for the residents of the state of California. Thank you.
Thank you for the comments, Dr. Yoshizuka.
This individual identified as John Gray. John, I'm going to send a request to mute your microphone. Request has been sent.
Hi, good morning. This is John Gray. I'm a registered pharmacist with Kaiser Permanente. Just first off, want to thank the committee for the continued discussion on this matter. Obviously, given the number of public comments, it's very important to a lot of people. Just a few things we want to flag and really echo some things from Board Member Patel's comments. First of all, before I go into the specific items, I will say we're generally supportive of the direction that the board is discussing, or the committee is discussing today, of trying to pass a bill that would give the board the authority to write a regulation on remote processing. But there are a few things from Board Member Patel's comments that we want to echo as it relates to that approach. First, we would say that the less prescriptive the statutory language is, the better from our perspective. Recognizing the time that it will take to pass a bill and write a regulation, by the time the board is ready to propose a regulation, the public's needs may have changed. The board's thinking may have evolved. And so you don't want to be handcuffed by the statutory language that allows you to write a regulation. Second, I think we would recommend the board, as it relates to Board Member Patel's comments about California licensure, we would encourage the board to avoid integrating requirements that are simply protectionist and promote rent seeking by currently licensed pharmacists. And third, and something that I'm surprised hasn't been brought up yet, is just to be cognizant of the timeline that you're committing yourself to. Board Member Patel conveyed that there ought to be a sense of urgency to this. and taking the approach of first passing a bill and then writing a regulation, you know, we would at best we would probably be talking about having a finalized regulation sometime in mid to late 2026, just given how the legislative and regulatory timelines tend to progress. So, you know, as you talk about this more, we would ask you to think about those few flags. And but again, we want to reiterate that, you know, if this is the only path forward, we think we are supportive of it, because again, this is an important issue, and we do want to see remote work moving forward for pharmacists in the state of California. Thank you very much for the opportunity to comment.
Thank you, Dr. Gray.
This individual, Lindsay Gillahorn, I'm going to send a request to unmute your microphone from my request has been sent. I'll set my timer to 3 minutes.
California Community Pharmacy Coalition. First, want to thank the board for all of the time that you've put into this. I know this has been a long discussion, a lot of details, and really appreciate the time the board and staff have put into drafting this proposal. We are absolutely supportive of permanent statutory authority to allow for remote processing for different types of pharmacy settings, specifically community pharmacies. As you've heard in public comment today and in the past, remote work really does provide greater flexibility for pharmacists who can balance work and home life more easily, less distractions in the pharmacy, which allows for greater focus on work and reduced medication errors. Remote processing also helps with workforce pressure in pharmacies by taking many of those time-consuming functions out of the physical brick-and-mortar pharmacy. Do want to point out, we agree with board member Patel. We don't think remote processing authority should be limited to licensed California pharmacies. We think if we have this limitation, remote work won't be fully leveraged to ensure patient access to care and assist with that pharmacy workflow. And actually believe that allowing remote processing to happen outside of California actually is consistent with the goals of recently enacted legislation, AB 1286, because again, it takes pressure off of pharmacists in California working at those physical locations. So would encourage the board to adopt broad authorization to allow remote processing in community pharmacy settings. And we do believe that remote processing is aligned with the board's objectives, both to protect patients and reduce stress in the pharmacy. Thank you.
Thank you for the comments, Lindsay.
Stephen Gray. Stephen, I'm going to send a request to unmute your microphone. Request has been sent. And you're unmuted.
Thank you. First of all, I'd like to also thank the board for continuing this discussion. It's been going on for a while, but it's very, very important. I think that with all due respect to the people that have prepared the documents, I think part of the problem with it going on so long is there's still a lot of confusion about exactly what you're talking about when you say remote processing. If you look at the document that is on the agenda, it first talks about 407 1.1, and it said this is known as remote order entry. Then it goes on to the background and tries to talk about a definition for remote processing. There is no definition of remote processing in either statute or regulation. Therefore, it gets very confusing. And in fact, it says this is defined to mean entering of an order or a prescription into a computer from outside the pharmacy or hospital. No, that's remote order entry, and the rules for it are already set in 407 1.1. So I think you would be better off starting the next discussion. Also, in your comment, President O, you talked about drug handling. And in fact, in the language that has been proposed, you're also talking about drug handling. Yet many of the comments you've received today were people who talked about, for an example, that for the past 3 years, they've been doing remote processing, but it had nothing to do with drug handling. And they're confused about whether they can continue to do what they do, which is often just medication management and making sure that the patient is getting the right medication, talking to them about their compliance and so forth, which is very, very important, not only with specialty drugs, but with many other drugs. So I really want to suggest that you take a look at defining specifically what you mean. If you're only talking about tasks that involve the handling of a drug, maybe the approval of the final drug that goes into the vial is something that the pharmacist could do remotely, then I think that would narrow the discussion and get perhaps more closer to reaching a general understanding. If you look at Regulation 1793, there is some discussion about what processing means in the context of a technician. And it talks about tasks that are not reserved to a pharmacist. It talks about repetitive tasks, etc. It may be that you want to use that as something that defines, what we mean by remote processing. Remote processing that does not involve drugs has been available for literally decades and is relied upon in order to manage drug therapy, not only from within the state, but from outside the state. I'm not commenting on whether this.
This is the moderator. I've muted the line. The 3 minutes were up. Next individual, Mark Johnson. I'm going to. Sorry, go ahead, Chair.
Oh, no, I was just thanking Dr. Gray for the comments.
Mark Johnson, I'm going to send a request to unmute your microphone. Microphone request has been sent.
This is Mark.
And you're cutting off a little bit. If you can just let me know again. Can you hear us?
Can you hear me?
Yes, perfectly. Go ahead.
Thank you. This is Mark Johnston with CVS Health. CVS Health is in favor of brief and expansive remote work. The overwhelming majority of the states already allow pharmacist remote work via brief laws. 27 states at a minimum allow technicians to also work remotely. The trend is not towards lengthy restrictive rules, but short allowing rules. For example, I would like to read from Florida's recent law change. Nothing in this section shall prohibit a pharmacy employee who is licensed in Florida or in another state from remotely accessing the pharmacy's electronic database from outside the pharmacy in order to process prescriptions, provided the pharmacy establishes controls to protect the privacy and security of confidential records. That is the only law in Florida that allows remote work, brief and expansive. When it comes to technicians, there is another line item, and that is for supervision. And that states that the supervision requirement can be met by technology that is used to enable real-time two-way communication between the pharmacist and the technicians. And that's it. And I could quote numerous other states that have very similar brief, expansive allowances, and I'm not aware of any issues that have arisen from that. So I encourage the board to allow remote work without establishing hurdles, as it is a tried and true safe operation, as proven by many, many other states and California itself for not just 3 years, but decades. Thank you.
Thank you for the comments, Mark.
Request to unmute your microphone. And Hossein, I apologize if I'm mispronouncing your name. I sent another request. You're unmuted.
Good morning. Can you hear me?
Yes, I can. Thank you.
Good morning, and thank you for letting me to speak. So I've been pharmacist for 8 years in community setting. And I think, I mean, I don't want to go on and on, but I think there is no shortage and for the pharmacists in California. And the problem I have, like the cost of living, at the end of the day, all the pharmacists, if they want to work in California, they need to be able to deal with the cost of living here. And if you, I mean, I don't have any problem with remote processing, but if you open it up to everyone in the country, of course, the chain pharmacy, system is going to take, for example, the work to a state that they can hire pharmacists to process a prescription for $40 per hour instead of, paying $65 per hour or $70 per hour in California. And in the long term, I think all the pharmacists, including me, we will decide to leave the state because, I mean, nobody can deal with, cost of living here if you're getting paid like $50, $60 per hour. That's a much bigger problem than, I think at the end of the day, it is a matter of if the pharmacist can survive with this little wages here or not. And as long as, the system, there is no limit for number of prescription that's being processed by pharmacists every hour. So I was in the store working and processing like 40, 50 prescription per hour. So of course, no one wants to work with this amount of pressure. They're closing out every stores and just pushing their, the prescription to the nearby store, and you get a load of prescription coming to your store without really getting any more hours or help. So you get to the position that you make error or you quit the job and just say, okay, I'm not going to do this anymore. But I think the board need to think about the long term, open it to the rest of the country. But at the end of the day, the cost of living is not going to decrease in California. And pharmacists who decide to stay, they need to deal with this. And, I'm sure that, the chain pharmacy is thinking about their profit, and they will take the job to the state that they can hire a pharmacist for $40 per hour, $50 per hour. Thank you.
Thank you for the comments.
Bob Geddes, I will send a request to unmute your microphone. Request has been sent.
Geddes, Director of Pharmacy Legislative and Regulatory Affairs for Albertsons Companies. And like to echo many of the comments that have been made, that we also appreciate the board for continuing this discussion and looking for an opportunity for resolution to allow this in the state of California. Would also like to echo the comments made by Jig, as well as many of my colleagues, that we would like the board to not limit this to only California licensed pharmacists, as well as the limitation that it has to be done within the state of California. At the very least, if you do want to provide some limitation there, we would recommend removing the within California, allowing pharmacists that may be licensed in the state of California that are not located in California to continue to support patients within the state. And the perspective that I would point towards is this allows for flexibility. During the pandemic, we did leverage work from home under the remote processing waivers. At this point in time, we do not leverage it, but that is, of course, a business decision for the company to make. And when there are emergencies that occur, disasters, fires, whatever it may be, there is a need for support in certain areas, and not having to create a waiver during those times of emergency to remove the limitation on California licensed pharmacists only performing this work would allow the state to work with much more expedience in responding to the public's needs versus having to go through the process of issuing a waiver to remove the limiting requirements within the law. So we would encourage you to not limit yourself and allow this to be a business decision and how that can be leveraged with flexibility, but continue to appreciate the work that the board is doing in progressing this conversation forward. Thank you very much.
Thank you for the comments, Dr. Geddes. Elizabeth?
Yes, can you hear me?
Oh, sorry, I couldn't hear you for a second.
Oh, I'm sorry. I will send a request. The next individual identified as Jazzy Grewal. Grewal, I'm going to send a request to mute your microphone.
Good
Sorry.
morning. Sorry.
Go ahead.
Good morning, board members. Jassy Graywall with the United Food and Commercial Workers Western States Council, speaking to express concerns with the remote processing proposal in front of the board. I believe a lot of the comments here have been stated, especially from pharmacists, is around specialty pharmacy. I do just want it to be clear that UFCW does not have concerns with remote processing and specialty pharmacy, and actually sees how there is a need for this. Where UFCW has concerns is around the chain retail setting and the utilization of remote processing. Similar to some of the comments that have been previously made by commenters, our concerns are related to the outsourcing of jobs that are going to happen if this is approved in all settings. We have seen remote processing work when it is conducted within a licensed facility. So that can be an office, off of the pharmacy, within a grocery store, or within a drug retail setting. And that is a place that we would be comfortable with. But when the work is outsourced into someone's home, have significant concerns around security, enforcement. How is the Board of Pharmacy going to go to all these different homes and enforce to make sure that they have all the proper requirements in place? And then also have concerns around liability. If there is a medication error that occurs, is it the pharmacist who remotely processed the prescription who made an error, or is it the liability on the pharmacist who delivered that medicine to the patient and what was not caught? So where does the liability fall in that chain? We have significant concerns about, especially if it's a pharmacist that the pharmacist in the store has no relationship with, or no way to contact that pharmacist who approved that prescription through the remote processing process. So that is where our concerns lie. We also have concerns with the board's proposal. It is very broad in the type of regulations that can be made through a legislative proposal. I think it will have significant challenges within the legislature around sending basically a regulation that is so broad and expansive with no specifics of what's included. UFCW would recommend that in the proposal it exclude community chain pharmacies, but if they are included, say that remote processing can only happen within the licensed facilities themselves. Those are our comments today. Appreciate the conversation.
Thank you for the comments, Jazzy.
Moderator. The next individual, Gina Ha, I'm going to send a request to unmute your microphone. And I'm locating your login. Give me just a moment, Gina Ha. Okay. Sent a request to unmute your microphone. You're unmuted.
Pharmacist with specialty pharmacy, and I also just want to second the previous comments to support remote processing.
Thank you for the comments.
Request has been sent.
Who are we on now, Elizabeth? Sorry, I don't see.
Sophia? We have a few that left actual comments, but we are calling on them to make sure they have an opportunity to verbally provide their comment.
Got
If
it.
that's okay
Okay,
with you, Chairperson?
of course.
Sophia, I haven't muted you.
I believe a lot of good points were made in support of remote verification and how it would support the consumer. And I wanted to just echo my support in regards to that. And I do agree the situation can be complex, but I do appreciate that the Board of Pharmacy is taking some time to address this and moving forward for the profession. The benefit of having these discussions is going to, in the long term, impact our profession and allow our profession to evolve with time. So I really appreciate that. Thank you so much.
Thank you for the comments. Anyone else, Elizabeth?
Yes, sorry, are you able to hear me?
Oh, sorry. I think it's a little choppy, but it's
Thank
okay.
you. Thank you. I'm gonna work here on my audio. Jimmy Kim, I sent a request to mute your microphone. You're unmuted.
Hi, my name is Jimmy, and I'm a pharmacist for the last 10 years. I'd like to second previous comments to support remote processing, specifically in specialty pharmacy front end. As we do not handle medications, we manage patient therapies that work exclusively on the computer and the phone. So we do our phone consultations with patients. We don't do any face-to-face patient interaction. And so just continuing on from what Dr. Gray was saying in terms of definition of what remote processing is, as we do not handle any medication. So it just only makes sense that we continue the remote processing as we have done the past 3 years. And thank you for your time.
All right. Thank you for the comments.
This is the moderator. No further requests have been submitted. Would you like me to close the Q&A? Oh, actually, I
please.
apologize. Modi, we were going to go back to
Yeah. Thank you.
in our attendees list. Give me just a moment. I think they may have logged out. Modi. Just a second as I scan through the list, make sure there's no new login. No. Okay, yeah. Would you like me to close the Q&A feature?
Sure. Yeah. Thank you.
Thank you.
All right. Thank you, everyone. Thank you for all the good comments. I really, really appreciate everyone's comments. And I know this is such an emotional and passionate issue for so many, so I really understand how you all feel. So from all what we've heard from where we are, I am going to open up for members. I am still hoping that we could proceed with this proposal today. This has been a very long road ahead of balancing everyone's interest and trying to land somewhere where we can go. But open for discussion, thoughts. Jesse, your hand is raised.
I think you've done. I just wanted to kind of highlight again what Dr. Dang said and what Dr. Yoshizuka said in their comments, and also just highlight that enforcement is a part of consumer protection. So we need some means of doing that. And I think the language as it stands right now does allow us to do that by only allowing California pharmacists to participate in remote processing work. I'm also curious to see what board counsel believes in terms of actually providing a definition, like Stephen Gray said, of what remote processing is. I think there is some confusion there. And then kind of getting back to item E, because it's specific to drug handling, I'm wondering if E is even necessary just because of F allowing the board to develop regulations specific to remote processing. Is this a separate thing? Is this specific to remote processing, or is this just a separate issue altogether because it mentions drug handling versus remote processing?
Great comment on that. Jason, if that's okay, I'm gonna put Corinne and Anne on the spot really quick of where that language came from. And I'm sorry to put y'all on the spot.
This is. I'm sorry, which language are you talking about specifically? And I'm probably gonna have to punt to Anne on this, but.
No, that's okay. It is the section E. In order to enable any accredited school of pharmacy recognized by the board to experiment with new and innovative methods for drug handling or to develop new and better methods or concepts involving the ethical practice of pharmacy, where that came from. I think Anne can probably explain that better. So I'll just put you on the spot, Anne.
Yeah, so this is Anne. So kind of the concept of section E there is really intended to, although, depending on where the board goes, right? I'm just talking like in general terms. If the board did do regulations, there would still be an opportunity for, for a school to do, to do research, to do a study that would waive the requirements of pharmacy law related to remote processing, right? Because we have the statutory restrictions or the statutory provisions, and then we have the regulation. So if there was some sort of new and emerging technology that the board wanted to understand more about the potential impacts to it before it updated its regulations, the board would have the authority to approve a study under the authority that would be provided in E to really allow for the board, the schools of pharmacy to assess, what this potential new business model would be, without having to change the law permanently. Then the board could be making a decision based on the data and the results of that study to help inform the policy moving forward. I hope that helped. Sorry.
Thank you, Anne.
I think that does help. I guess as a follow-up is that, I guess, there's a concept behind it that it could potentially be something that doesn't necessarily fit in subsection F.
Yeah, I think that that's part of what it envisions, Jesse, is that it could go beyond, but the way that the language is attempted to be drafted, right or wrong, is that, you have statutory provisions as well. So this would actually allow the board to waive both the statutory and or the regulatory, right? You have a decision, you have authority to do one or both under the draft language because, trying to anticipate what the future looks like, it was kind of intended to provide the board with better options. I'll just quickly highlight that the board does have authority to waive regulation requirements right now under the auspices of a study, but it's limited to just regulation. So the significance of this specifically is it would give the board the authority to also waive statute specifically related to the remote processing provisions.
Okay, thank you so much for that explanation, and that really helps.
Thank you. Any other Jason? Let's go to you next.
Thanks, Song. I really do appreciate the public comment. I thank you for your input. I know that people would like to go and expand remote processing to pharmacists from outside of California. I hear that. I understand the desire for it, but I do believe that there is a public safety issue that we have wanted to maintain. We have heard from numerous pharmacists here within California indicating that they would like the flexibility to work here within California. And I think that's what I would like to advance, and I would support moving the motion as written. Thank you.
Thank you, Jason. I have a motion. Do we have a second?
I apologize, just for purposes of the minutes, is that motion to recommend to the board sponsorship of legislation consistent with the language within the packet?
To move it before the full board for consideration, yes.
Thank you.
Thank you.
I apologize, this is Corinne. Could I just interject because Member Crowley had asked previously for clarification on one issue and didn't know if the board.
Oh yeah, Corinne, sorry. Go ahead and respond to that. I'm sorry, I just got sidetracked. Go for it. Sorry.
Yeah, I think she was asking about some of the comments, specific to including a definition of what remote processing means. And I mean, I agree that currently there's, nothing in there that addresses that specifically. I'm pretty sure that in the waiver, that expired, that there was an attempt to make a definition. And so, something along those lines could certainly be worked in. But just wanted to put that out there to respond to that question.
Yeah, if I could also just add, Corinne, do you believe that the definition could be facilitated through the regulation language?
I think it could be.
Okay. Thank you for that clarification. Go ahead, Jesse.
Just a question, I guess, as a follow-up. If we're proposing this through the legislature, are we going to run into an issue if we don't define it now? Because there may be confusion as to what we actually mean. I'm wondering if maybe it's a good idea to take the language from the previous waivers so that it's as clear as possible as we propose this through the legislature.
And this is Corinne again. I mean, similar to what one of the members said earlier, I mean, we can't predict what the legislature is going to do, but that is a consideration that the board would probably want to take under advisement.
Thank you.
Okay, Jason, are you amenable to possibly adding that language of defining remote processing in this section? And I think we could develop a definition and hopefully have a proposal for the full board in a couple weeks. And we could reconsider that if there is a motion, if you want to keep that motion for that.
I'll accept that amendment. Thank you, Sung.
Okay. Would that work, Corinne and Ann? I mean, I guess I need to find second first before I go jump the gun. So let's see if we have a second on this motion. If no,
I'll second.
thank you, Jesse. With that, Corinne and Ann, can we work on something of drafting a definition into this 4071.1, and then hopefully we can have an updated legislative proposal for the full board in 2 weeks, and then we can vote on, have a recommendation for the full board.
So I think that's pretty consistent with past practice. Generally, the motion does include authority for the chair to work with staff and council to refine the language in advance of the November. So that may be something that you want to include in the amended motion.
Okay, Jason, are you okay with that? Sorry to put you on the spot again.
I am okay with that, Sung, and I think that there's just some urgency. We have heard from numerous people on all sides of this issue that we should advance forward in some way, and I think it's important that this issue appear before the full board. So I will accept that amendment also. Thank you.
Thank you. Thank you, Jesse. Are you okay with that as well?
I'm also okay with that, yes.
Thank you. All right, with that, any other member comments? I'm trying to somehow progress this discussion somewhere where we can land. We've been talking about this for about 2.5 years, and I think we need to try to go somewhere. So I'm hoping that we can at least just take one little step. So with that, any other member comments before I open up for public comment one more time? All right. Elizabeth, it's your turn again. Sorry, it's a long meeting today, everyone. We'll take a break after this agenda item. We'll see where we go with the public comment, but we'll take a break, get some coffee. Somebody may be able to go get some Celsius, as you know, that seems to be a cool drink these days. Everyone drinks. So.
This is the moderator. I've opened up the Q&A. The instructions are on the screen. For those that would like to participate and are logged in, Click on the question mark inside of the square, bottom right corner of your WebEx screen, type the word comment. Make sure it asks all panelists before you click send. Or if you're calling in from a phone, press *3 to raise your virtual hand. I'm going to set up my timer, and I have first individual identified as Stephen Gray. Stephen, I'm going to send a request to unmute your microphone. Request has been sent.
Thank you very much. I do make a suggestion that the committee members have a little more discussion about what the definition really should be to give guidance to chair and to council. For an example, are you only talking about tasks that involve the drug handling or the final approval of the product? Or are you also talking about those tasks that people have been doing for 3 years that had really nothing to do with drug handling, such as what we heard from the specialty pharmacists and so forth? Again, I think you haven't had that discussion about where you would draw the line between what is drug handling or what is truly remote processing in this context. I would also point out that under the current statute, the definition of someone who can do an order entry includes a pharmacy technician, as long as that technician is in, by other law, is in a licensed pharmacy being supervised by a pharmacist. And in fact, that has been done for many years now since that statute has gone into place. Thank you very much.
Thank you for the comments, Dr. Gray.
The moderator. Next individual identified as Jazzy Griwa, sorry. I will send a request to unmute your microphone. And Jazzy, the request has been sent.
Thank you. Jassy Graywell with UFCW Western States Council. Want to echo the comments of the previous speaker. I think this proposal needs more discussion. In addition to the definition of what is considered remote processing, I think there needs to be additional information within the proposed proposal around the scope of remote processing and the practice settings. I mean, there is no mention of enforcement. How will enforcement of this happen? So I think there needs to be more specific. A proposal like this within the legislature could be seen as an illegal delegation of power to an agency if it's not specific. So I think for us, it would be really helpful to want to have a definition, the scope, how is enforcement going to be considered? I think there's still a lot of unanswered questions in this proposal and think it could use additional time. Thank you.
Thank you for the comments, Jazzy.
There are no further requests. Would you like me to close the Q&A feature?
Yes, please.
Thank you.
All right, members, we're any member comments before we go for vote? Okay, we'll go for the vote. Jake, how do you vote?
Yes.
Thank you, Jake. Renee, how do you vote?
Yes.
Thank you, Renee. Jesse, how do you vote?
Yes.
Thank you, Jesse. Jason, how do you vote?
Yes.
Thank you, and I vote yes. Thank you, everyone. I understand this discussion is so complex. Again, I thank you all for your participation. I see that there's so many folks in attending probably for this item. And of course, we're never shy from touching on controversial issue as our next agenda item is discussion and consideration of tech ratio. However, I think we all need a break. So we're going to take a quick 10-minute break and we'll come back at 10:55. 10:50, well, might as well make it 11. So we'll come back at 11. I think everyone deserves a little long break. So 11 o'clock, everyone, 11 o'clock. See you soon. All right, it's 11 o'clock. Hopefully everybody got some little break. Let's get back on it. Our next agenda item 5, discussion and consideration of pharmacist to pharmacy technician ratio. And I'll take a quick roll call. Jig, I see you're back. Say hello verbally.
Yes.
Hi, Jig. Renee.
Oh, I have returned.
Hi, Renee. Jesse.
Hi, I'm here.
Hi, Jesse. And Jason.
I'm here, Sal.
Hi, Jason. And I am back. All right, let's get started. Just a heads up, today's meeting might be a long one, so we still have quite a few items to go after this one. But we'll take a lunch, hopefully around like 12, and we'll come back. Hopefully everyone can stay all day. As I shared during our last meeting, I intended to focus committee discussion on strategic objective 1.3 related to the exploration and pursuit of changes in law appropriate for the authorized duties of a pharmacy technician. An important first step in this evaluation included this committee convening listening sessions and soliciting feedback from licensees regarding potential changes. The results of these efforts were incorporated in Assembly Bill 1286, which the governor signed earlier this month. It's a monumental legislation. We're very proud of that. Implementation of that measure will be discussed during the Enforcement and Compounding Committee meeting tomorrow. This was an important first step, but I believe additional changes may be appropriate. As we continue our assessment of the pharmacy technician licensing program, one area the board continually receives comments on is the issue of the pharmacist to pharmacy technician ratio. The meeting materials detail the current law related to ratios. As the materials note, members routinely receive public comment indicating that California has the most restrictive ratios. This, of course, is not an apples-to-apples comparison, as jurisdictions have varying approaches on provisions for services within a pharmacy, including where some jurisdictions require all pharmacy personnel to be licensed as a pharmacy technician if performing basic functions such as data entry. This is not the case in California. I highlight this only to remind us that when comments are received, context matters. The meeting materials highlight a few approaches taken by various states. While I'm not certain we will reach a recommendation for the board today, I believe this discussion, while very challenging with many competing interests, it is also very important. As you all know, this topic has a long and controversial history, and I want to be very mindful of approaching it in careful and meticulous ways as much as possible. To aid in our discussion today, the meeting materials include several questions. I intend to list first, discuss each policy questions among members, and will then open the discussion to members of the public attending the meeting today. So starting with question 1, do members generally believe, that an increase in the Elizabeth, I think slide should have questions hopefully up. Do members generally believe that an increase in the pharmacist to pharmacy technician ratio could be appropriate in additional pharmacy settings than those currently authorized, such as closed-door pharmacies, compounding pharmacies, nuclear pharmacies, etc., etc.? So my belief is yes. As I previously shared, philosophically, I am concerned with the board parsing out different rules for different pharmacies. Such an approach allows the board to be more flexible and deliberative in its regulation, but also has the potential to parse out the profession, which I'm not confident is always in the best interest of patients. What I'm looking for is more flexibility, and I'm certain that some settings can absolutely be able to have more than one technician to one pharmacist. So members, I welcome your thoughts. Jake, your hand is raised, so go ahead, Jake.
Yes, I mean, I think increasing the ratio would take stress off of pharmacists to do more clinical duties and be there for the consumers. Let it be medication therapy management to just appropriate time spent for counseling each prescription. One of the things that we could do as a board or suggest is, we could give the PIC the authority to determine based on the setting, because every setting is different. Even if you take a hospital pharmacy, different hospitals will have a different type of workflow and what they do there. Even community pharmacies, there are community pharmacies that does compounding along with regular count, pour, and fill. Um, so I think maybe just giving the whole authority to PIC and not having ratio is something that comes to my mind. But I think having ancillary licensed professionals in the pharmacy other than pharmacists would definitely take the stress off a pharmacist and improve overall service they provide to consumers in all settings.
Thank you, Jake. Thanks for the comments. Any other comments? I would hope that everyone has a thought on this topic. Jesse, go ahead.
Hi, so I think the ratio as it exists now does differ just based at least on hospital setting versus other practice settings. I would be curious to hear more insight from closed door pharmacists or nuclear compounding pharmacists. I will say from a community perspective, I would not feel comfortable expanding the ratio. I think in theory, the concept of more technicians sounds like it would be helpful, but just as an example, right now I have an AP rotation student at my store. So there's one day a week where I'm supervising a clerk, a technician, and my intern. And my intern has very little experience in retail. One of my technicians is also fairly new in pharmacy. And so that day having to work and supervise all of those people at the same time actually ends up being more work for me because I'm kind of having to keep my ears open and supervise what they're doing while simultaneously doing my work. So it ends up being a little bit more of a stress. So I worry about that. The other thing to keep in mind as we have this discussion moving forward is we already know that there's a technician shortage. We've heard time and time again of how difficult companies have had just trying to find technicians. And so I'm not sure what the ultimate end goal would be of expanding the ratio if we can't even get technicians to come in when the ratio is 1-to-1. So I hope that we can kind of like loop that into the discussion.
Thank you, Jesse. Any other thoughts? Renee? Oh, you're muted, Renee.
Sorry. I was going to say, I think I more echo your response that I do think there are pharmacy settings that don't fall neatly under these categories. And I know there's listed a couple of example pharmacies and, I wouldn't, I'm sure there's others that could be discussed. I also think that, like Jig mentioned, that, the PIC definitely needs to be involved in that decision or that flexibility to move up or down. But I do, even though, like, I know I appreciate the comment about the technician shortage. And I think we're looking at kind of a long game here. So hopefully not have the shortage for a long time. However, I do think there's opportunities in other pharmacies that maybe people would like to move to, but if they can't have that many technicians, they're not able to, possibly in nuclear compounding, for example. So I would say that yes, in general, I definitely believe that there should be an increase in the technician ratio, but again, the settings, I'm not sure that how we would define all the settings. That might need to be discussed as well.
Thank you, Renee. And going to Jake. Oh, Jake, you're muted.
Sorry. I'm repeating myself a little bit here, but PIC's making that decision makes more sense based on what Jesse said. circumstantial, right? I mean, you have somebody that does not have experience on that day and can perform. And as a pharmacist, how much attention I can give to a intern today. Or, but the scenario might change next week where, I have two technicians working with me, and now I can expand that. One of them is really qualified, experienced, can immunize. I trust that these folks can do their jobs, and I can securely, safely oversee their operation and what they're doing, and it would change. Hence, the flexibility part is important, and rather than having per se set number.
Thank you, Jake. Jesse, your hand is raised. Did you have another comment?
Yeah, I forgot to comment on just the thought of PIC flexibility. I think in an ideal world, that would be great, but the reality for many PICs is they don't really have autonomy, whether they work for a chain pharmacy who they ultimately report to a district manager or to the company themselves, and they may be at risk of retaliation should they believe otherwise. There's a lot of consequences for the pharmacy, so as it exists today, and also for some independent pharmacies where they may be reporting to an owner who has their own interests in mind. And so I just think that we should consider that. But I agree, in an ideal world, it would be nice for the PIC to have a say in what they believe their pharmacy needs are and demands in terms of the ratio.
Thank you, Jesse. Go ahead, Jason.
I just wanted to let you know, Sung, that I am looking forward to hearing the comments from the public and furthering this discussion. Thank you.
Thank you, Jason. All right, we're ready for public comments. Now, specifically to question 1, now that members and public may generally believe that an increase in the pharmacist to pharmacy technician ratio could be appropriate in additional pharmacy settings than those currently authorized.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click that question mark inside of the square, typically lower right corner of your WebEx screen, and type the word comment in the text field. Make sure it goes to all panelists before clicking the send button. If you're calling in from a phone, press *3 to raise your virtual hand. At this time, I do have a few requests. We'll start off with Paige Talley. I'm going to send a request to unmute your microphone. I have set my timer to 3 minutes.
Okay, thank you. I'm sorry I cut you off. This is Paige Talley representing California Council for the Advancement of Pharmacy. And within this question, you mentioned closed door pharmacies. However, in long-term care, we are closed door pharmacies, but only nursing homes, skilled nursing homes can use the 2-to-1 ratio or 1-to-2. And we have a lot of RCFEs, ALFs, which are kind of the same thing. And we cannot use the ratio, the additional pharmacy tech when filling those prescriptions. We have to fill skilled nursing homes separately, which is cumbersome. So I recommend that you change closed door to all closed door pharmacies and allow the 1-to-2 ratio or more. Even with long-term care, we could use more. Thank you.
Thank you for the comments, Paige.
Next individual identified as Richard Dang. I'm going to send a request to unmute your microphone.
Hi, thank you to the committee for engaging in this conversation. Richard Dang on behalf of the California Pharmacists Association. As the committee has noted, AB 1286 has recently just passed, which does have several provisions that the committee is discussing today that is already addressed. AB 1286 will give the PIC authority to make staffing decisions within their specific pharmacy and does adjust some of the tech ratios when it comes to certain clinical services, specifically with immunizations, allowing for an increase for those technicians that are not dedicated to only dispensing. This bill will be coming into effect January 2024. So we do believe that we need to give this bill some time to be implemented, monitored, and enforced before any further decisions are made regarding the pharmacy technician ratio. However, we do believe that it is great to start discussions early, as we know it takes time to go through the regulatory process. We do advise, however, to not act until at least a year has passed to see the effects of the enforcement of AB 1286, to see if it has addressed any of the issues or not. Having said that, CPHA will be planning to convene a work group of several stakeholders to discuss this exact issue so that we can come back to the board at a future meeting with some expert opinion as to what recommendations we might have regarding this specific item. So, we do recommend continued monitoring, but continuing discussion in the background. At this time, it might be premature, as I mentioned. Additionally, I think it was Jess who mentioned there is a technician shortage, so increasing the ratio may not have the desired outcome that we are discussing. And we also do believe that the discussion should actually be centered not around a pharmacy to technician ratio, but around a ratio tied to volume of work. I think that is the true issue that we're trying to get at, as far as potentially script counts, vaccinations administered, or other services offered, tying the number of pharmacists and the limits within what can be dispensed and verified by a pharmacist within a certain hour or certain workday may be more appropriate to appropriately address these concerns that we have. We do recognize that there are variations amongst many practice settings, and there is no perfect number for what that volume ratio might look like. And that is the purpose of the work group that we'll be convening, to see if we can come to some sort of consensus overall, or at least within specific practice settings. Thank you for the opportunity to comment.
Thank you for the comments, Dr. Dang.
This is the moderator. Next individual, Vincent Cherries. I'm going to send a request to unmute your microphone.
Can you hear me?
Yes.
Okay, sorry. um, I would just say that when you, in further discussions of this technician to pharmacist ratio, you should also be considering the community pharmacy setting regarding pharmacies or drive-throughs. Those are different, for lack of an elegant word, beast when working in those pharmacies, especially when you have a skeleton crew. Honestly, any technician shortage is the employer's responsibility and consequence regarding their pay rate to retain staff. I know at CVS, in my bargaining unit, we did not want to start technician pay below $17, nowhere near that, but that is what CVS labor relations wanted. They did not feel a need to invest money in starting pay for technicians. So that's where I kind of stand in terms of where we should be getting feedback regarding this issue. It should be coming from the pharmacists at least, which again, I'm encouraging more of a survey for community pharmacists as well. Thank you.
Thank you for the comments.
Next individual identified as Stephen Gray. Stephen, I'm going to send a request to unmute your microphone. Request has been sent.
Thank you very much. I would like to encourage the board to do a little bit more investigation about what's really going on. I was very much involved with the subject of setting the ratio as it is way back in the early 90s. The big issue there was the pharmacists that were working by themselves. That's why the ratio currently says only one tech per one pharmacist on duty, but then when you get more than one, you can move to 2 techs on duty for each additional pharmacist. Since then, my surveys, and I've done quite a few asking over the years, I encourage you to ask those people who are working by themselves, those pharmacists that are working without an additional technician. Those are the ones that keep asking for more technicians. And I would suggest that. I'd also, you cannot discuss this subject without taking a look at what the technician duties are, what differentiates a clerk from a technician, and that is specified in the regulations. And so too many pharmacists are still counting pills and putting on labels when they should be talking to patients and paying attention to other things going on in the pharmacy. So you need to look at both subjects together. Thank you.
Thank you for the comments, Dr. Gray.
Keith Yoshizuka, I'm going to send a request to unmute your microphone.
Keith Yoshizuka, California Society of Health System Pharmacist. I wanted to say that I appreciate the board looking at this, examining this timely matter, particularly in light of the governor's signing of AB 1286, in particular, reference to a community pharmacy where there is only one pharmacist, but one of the provisions in 1286 was that you can have a technician prepare and administer COVID and flu vaccine, specimen collection for CLIA-waived tests, receive prescription transfers, and accept prescription clarification, but only if another technician is scheduled. So I believe what the statute, the newly approved statute, is doing is therefore allowing a second technician where there's only one pharmacist working, as long as one of the technicians is involved with the administration of vaccines, so on and so forth. But I appreciate the board looking into this. Thank you.
Thank you, Dr. Yoshizuka.
This is the moderator. Last individual, Lindsay Gullahorn. I'm going to send a request to unmute your microphone.
Hi, again, thank you. This is Lindsay Gullahorn with the California Community Pharmacy Coalition. Also want to thank the board for exploring this issue again. We think it's an important issue. We think one of the most significant ways we can make changes in California to improve patient care, consumer safety, and reduce workforce pressure is to expand the ratio. We think there should be a true expansion of the ratio. As many of you know, half the states in the country don't have a ratio at all. And in these states, there's been no demonstrated risk to patients. On the contrary, increasing the ratio here in California would take stress off the pharmacists and allow them to focus on clinical duties. This is better for workflow, it's better for patients. Also want to echo board member Patel's comments that we think it should be up to the PIC to determine the ratio based on the type of practice and the PIC's level of comfortability. With respect to the technician shortage, also agree with board member Barker that an expanded ratio should be in place for when and where there are enough technicians. This would provide greater flexibility in staffing to meet patient need for care and take stress off the pharmacist to allow them once again to focus on clinical duties. And with the recent expansion sponsored by this board in AB 1286 in technician duties, an expanded ratio really would go a long way in helping the pharmacist and expanding access to care. Even a slight expansion of the ratio would address, I think, many of the concerns raised by this board that were the impetus for AB 1286 related to workforce stress. I know AB 1286 touched on the ratio slightly by allowing that additional technician only for certain duties, but we do believe a broad expansion, once again, would do a lot to improve patient safety and help in the pharmacy with workflow. Thank you.
Thank you for the comments, Lindsay.
This is the moderator, Nicole Cover. I'm going to send a request to unmute your microphone.
Hello, Nicole Cover. Once again, thanks for your time. I won't repeat any of the things that's already been said, but I've been practicing for 26 years And I was a pharmacy manager in Michigan as well, where we have no ratio. And I would echo what the person said earlier. You know, it's really, we spin whatever it is to protect whatever it is we're trying to look at. We say there's a shortage in technicians, but not pharmacists. But ideally, the profession just needs to be united. We don't talk about chain health system or chain this or chain that. Like, we should all be working together to say, this is what is for this public health and safety. We all take a part in it. We all need to be a part of it. And the ratio and the arguments that go for and against, there are several states that have not had ratios ever, and there's not 20 technicians working with me in my store as a pharmacy manager. It didn't happen. And so I think we read things or we see things and we speculate, but maybe we should talk with those pharmacists. Tennessee did a great example of the pharmacist in charge at a chain drugstore in their public meeting. They said we need to increase to this 6-1, and this is why. So the chain didn't respond for them. The chain didn't say anything around it. So I think there's a lot of like people assuming things, and the board recognized that and said each individual pick gave us a different reason for why they wanted to increase. So I think we should branch out and look collectively as a profession and stop the civil war within each segment and really work together to unite our profession. Thank you for your time today.
Thank you for the comments.
Moderator, no additional requests. Would you like me to close the Q&A?
Please. Thank you so much. All right. With that, going to question number 2, unless members have any other thoughts, I'm going to move forward because we got a lot going on. I think we're going to have a lot more opportunity to comment. This is just the starting point of the discussion. Do members believe that establishing a ratio of 1-2 could improve patient care in all pharmacy settings that currently do not allow such a ratio? To me, I believe this could be yes, but sometimes the devil's in the details. And I think AB 1286 included some very, very important provisions related to staffing that I believe if we implement it correctly, that'll ensure across the board ratio increase of 1-2 at one point in the future. But if that is too far too soon, at least maybe we can contemplate a petitioning process to allow the board to have businesses petition for expanded ratio. Another approach may be regulation authority. We're going to talk about those in question 3 and 4. So with that, I see Jesse's hand is raised.
Hi, John. Yeah, I agree that there's the potential. And then one of the topics that's just coming up is, you know, there are different qualities of technicians. I think that's in part due to the different pathways to licensure here in California that can vary from state to state. And just as an example, any technician that I've ever worked with who has gone to technician school or is nationally certified is of higher quality than those who did not go through either of those paths. So I think it has the potential, but it really depends. It depends on the individual, the route of licensure. Yeah. And kind of getting to a point that I think a couple of people have mentioned thus far. I think this topic is worth expanding on. You know, there's only so many pharmacists who can actually tune into these board meetings, and so I'd like to kind of propose doing a survey at some point so we can try to reach as many pharmacists as possible and get their input from various practice settings on what they believe an appropriate ratio would be and kind of why, so we can have a more robust discussion with the pharmacists who are going to be impacted by the ratio.
Great thoughts, Jesse. I think I have maybe an idea about the survey. Go ahead, Jake.
Yeah, 1:2 as a cookie cutter across the board. I don't know if that fits well. For example, like Paige Talley made a comment about, closed door facility. If I'm a PIC, one pharmacist, and you're doing 1,000 bubble packs for the day, if I could have 3 technicians do that for the day, and then, I myself as a pick check the prescriptions that are filled after, I don't see an issue with it because there are just 3 stations, they're filling in 3 prescriptions. The 3 technicians are doing the work. the ratio is 1 to 3 in that scenario. And again, you let the PIC decide and for any setting, and that would be the best outcome for this, in my opinion.
Thank you, Jake.
Yeah.
Any other thoughts? Or we open up for public go ahead, Renee.
Yeah, I was kind of trying to formulate here, but yeah, again, there's been a lot of great comments, and I appreciate the board comments as well. I'm definitely in support of establishing a larger ratio, and I kind of echoing what Jig said. I don't know that setting one to 2 exactly, because again, different settings and functions could definitely just have more technicians to do what they're allowed to do. And so again, that would have to be modulated, and that would only be through, or should, I should say, in my opinion, be through the PIC, determining what's being done. And I appreciate the distinction between the, like just different technicians, but I think the same is true for pharmacists when you're working and different people that get hired. So that's usually comes along with training, and I understand too with interns. I don't know how much that is an experience of the majority of pharmacies across California. So sometimes, unless you are near a pharmacy school, you don't necessarily have interns and that oversight. And to me, that distinction is that they are training. That's kind of the understanding. They've come a different route. So they still are, providing the work because they're employed as an intern. So I just think establishing a set number ratio may not serve all of the pharmacies well.
Thank you, Renee. Thanks for the great comments. Okay, I think we're ready to hear from public on the question number 2. Do we believe that establishing a ratio of 1 to 2 could potentially improve patient care in all pharmacy settings that currently do not allow such ratio? Moderator?
Moderator, the Q&A is now open. The instructions are on the screen for your reference. If you would like to participate and you're logged in, click on the question mark inside of the square, typically lower right corner of your WebEx screen, and type the word comment in the text field that appears. Make sure you're asking all panelists before you click that send button. For those who are calling in from a phone, click *3 to raise your virtual hand. So I'll get started with Paige Talley. Paige, I'm going to send a request to unmute your microphone, and I'm setting my timer to 3 minutes.
Thank you. Paige Talley, representing the California Council for the Advancement of Pharmacy. I agree with both committee members who previously spoke, Jig Patel and Renee Barker, and that it depends upon the setting as to whether you have 3 or 4 technicians or 2 technicians. And I would like the question to be changed, because it says, I don't have it up on my screen now, but I think it said could improve patient care in all pharmacy settings that currently do not allow such a ratio. And it was mentioned in the first question about closed door. And as I explained earlier, closed door pharmacies are allowed as long as they're filling skilled nursing facility prescriptions in a 1 to 2 ratio, but not other congregate living facilities. So I would like that changed, please. Thank you.
Thank you for the comments, Paige.
Next individual, Vincent Cheers, I'm going to send a request to unmute your microphone.
Can you hear me?
Yes, we can.
Beautiful. I want to point out the PIC capability. I think you need to also maybe consider adding protection for them in terms of if they do add in hours, they cannot be reprimanded for that, because unfortunately at CVS that is a common thing where hours are part of your budget and managers do get chewed out for going over budget. I'm not sure if you could add in some kind of protection language for that, like you did with the quota bill. Also, I think someone did mention it. I thought that was a very interesting idea that should be talked about more, tying the technician ratio to maybe the amount of scripts that are being filled at a time, because unfortunately, we have to go by what the company says we need to schedule, and sometimes the schedule says that you don't need a technician or you don't need any help at all for a lengthy period of time. Obviously, that needs to be addressed, but I do think that should be explored more for whoever said that about tying it to the amount of prescriptions a pharmacist has to fill within an hour. Thank you.
Thank you for the comments, Vincent.
Our next individual, Mark Johnson, I'm going to send a request to unmute your microphone.
Hello, this is Mark Johnston with CVS Health. Before I was executive director of the Idaho Board of Pharmacy, I watched Idaho go from a 1-to-1 to a 2-to-1 to a 3-to-1 ratio stepwise. When I was exec, we met with all practice settings and decided upon a 6-to-1 ratio. For the 7.5 years that I was executive director of the board, never once did I see an issue that was attributed to ratio. My predecessor then eliminated the ratio, and famously he goes around to continuing education programs also saying that never was there a violation, a prescription error, etc., that was ever attributed to eliminating the ratio here in Idaho. There are over 50% of the states in the nation that don't have a ratio. California has the most restrictive ratio. The trend is to increase or eliminate the ratio. As we see, Louisiana just promulgated within the last month an increase from 3-to-1 to 4-to-1. And Florida, which relates to this particular question number 2, who has a divided ratio depending upon practice setting, which can go anywhere from, I believe it starts at 3-to-1 and goes up to 6-to-1, depending upon the practice setting. They have a proposed rule and just had a hearing this week to just eliminate their ratio. So I believe the evidence across the nation is that increased ratios help with public safety. They don't cause public safety issues. And, perhaps we could learn from what other Board of Pharmacies have already done. Thank you very much.
Thank you for the comments, Mark.
Next individual, Stephen Gray. Stephen, I'm going to send a request to unmute your microphone.
Thank you again for the opportunity. I also believe strongly that the ratio needs to be increased, especially the 1 technician to 1 pharmacist ratio. I also believe that a little understanding of the history may help in this. The Regulation 1793.2 lists specifically 5 things that define a pharmacy technician's duties, differentiating then a pharmacy clerk from a pharmacy technician. Very quickly, removing the drug from stock, counting, pouring, and mixing pharmaceuticals, placing the product in a container, affixing the label or labels to the container, and packaging and repackaging. The reason those were put in regulation is because the law, the statute, used to have the regulation used to say that those could only be done by a pharmacist. So way back in the early 90s, there was very much concern about having new pharmacy technicians and people would lose their jobs. So it was negotiated to be put in the regulation, the definition of those tasks. But the ratio was put in the statute, as you all know, for those types of pharmacies, because it quite frankly, literally, the board was not trusted by certain entities to have the board have regulatory authority over that. Conversely, for hospitals, the board has the authority to increase the ratio beyond what is said right now, which is a 1-to-2 ratio. So I think that it is very important to know the history, and as I said before, we have too many pharmacists that are removing the drug from stock, counting and pouring, placing a label, putting the product in a container, etc., when they should be talking to patients, training pharmacy interns, or otherwise looking after the professional affairs that are done in the pharmacy. Thank you.
Thank you for the comments, Dr. Gray.
This is the moderator. Next individual identified as Max O. I'm going to send a request to unmute your microphone.
Pushing more techs on pharmacists. Every prescription, has an opportunity for serious, investigation by the pharmacist in multiple levels, whether it's inappropriate prescribing, whether it's interactions, whether it's safety for the patient. Just pushing more scripts on a pharmacist because there's more demand that day. It doesn't answer the problem of, having the pharmacist having time to work on these prescriptions. As was said by the previous moderator, comments, the board really needs to look at what is the maximum that a pharmacist can really fill in one day. The time that right now we're having conversations about the opioid epidemic at chains because of all the lawsuits, and they want every opioid to be treated as its own pretty much prescription. Like, where's it coming from? Who's the prescriber? You can't just say that, oh, it's 28 out of 30 days, it's okay to fill it. All this level of work on each prescription can't be solved by another tech pushing another script to be checked quickly so a patient can leave with their prescription. Thank you.
Thank you for the comments.
I'm going to send a request to unmute your microphone.
John Burroughs Middle School is really close.
And Joanne Klein, I've just sent a request.
I cannot hear anyone. Elizabeth?
Moderator. Okay, now Joanne Klein, you are unmuted.
I'm sorry about that. I don't think it's a good idea. I think the ratio should stay as is. You're just giving the big organizations like CVS and Walmart and Walgreens license to push more work on the pharmacists rather than less. You're not saving pharmacists anything. In fact, I don't see very many people following the regulations right now. I'm seeing more technicians or people behind the counter to one pharmacist. Pharmacist is doing way too much. It's not right. I'm sorry, but it's wrong. But that's my opinion.
Thank you for the comments, Joanne.
This is the moderator, Gina Rosita. I'm going to send a request to unmute your microphone.
I did call in. Can you hear me?
Yes.
Yes, we can.
Oh, thank you. So I actually do find that having only a one pharmacist to one tech can be incredibly difficult in an inpatient setting. In that setting, we really do need to have the first pharmacist in to be able to have two technicians. We struggle with that in our infusion center pharmacy. So I do believe that it's important to allow more technicians per pharmacist.
Thank you for the comments.
This is the moderator. I see no further requests. Would you like me to close the Q&A?
Yes, please. Thank you, Elizabeth. All right. Members, any thoughts before we move on to the next question? All right, we're going to go for question number 3, Elizabeth. Going to the next. Do members believe the board should have flexibility to have authority to approve a higher ratio on facility-specific basis? So I think this concept is very intriguing and may provide a path forward by allowing the board some flexibility to make a decision based on a specific set of facts for a specific entity. I know this approach could be administratively time-consuming to both staff and members, but historically, the laws and regulations have been successful in separating out entity types and following different rules too. So I think this may be a path forward for us. With that, Jake, your thoughts?
Yeah, I believe there is one state that has that practice in place. North Carolina, I believe. Maybe we can get some perspective from them. I mean, I'm just thinking. Because obviously we are a much bigger state, and the workload around that, it's not gonna be one of those applications like offsite storage permission or anything like that, where we probably don't get that many. This one pretty much, I can say 70 to 80% of licensed pharmacies would be applying for this. So
sorry, Ann. All right.
So I think the whatever we put, it should be specific, but I would not leave it. I'm not in the favor of doing that. That's a lot of work for the staff.
So you don't think that this is a good idea, Jake? You think this is okay? Okay, Jesse?
Yeah, I think it's an interesting concept. It does raise other questions for me as well, though. Like, what would be the criteria for the board approving a higher ratio? Is it something where it's like a volume basis? And at what point as a board do we look at the volume of the volume that one pharmacist is doing by themselves in a shift and think, okay, there probably needs to be a second pharmacist. For example, I've had friends who work in inpatient settings who have told me that they've verified over 1,000 prescriptions in one shift. Regardless of who you are and how quickly you can verify, I think objectively we can probably say that that isn't safe. Just thinking about peak flu season and COVID season now, we have pharmacists who are administering over 100 vaccines a day by themselves. And so I would be interested in having more of a dialogue at what that criteria would be for the board to approve a ratio. But I think it's an interesting discussion to be had, and I'm not completely opposed to it.
Okay, sounds good. Yeah, I think this is a path forward just so that, somewhere in between 1 to 6 unlimited ratio to 1 to 1, like where we are. So just to get some balls rolling. Renee?
So I do think that this looks like a very challenging approach. I think the board having the flexibility to approve a higher ratio, I think on the facility specific basis, I would be interested to see what that would look like, exactly what that means, because I think it looks like, I mean, as Jig mentioned, we have a lot of facilities if you go by license, right? And so what each one would request and what would we look at? So while I do think this is a worthwhile discussion in terms of increasing the high, looking at what is a higher ratio and what should it be, I'm not sure about on a facility specific basis. So I kind of have a agreement with that and a question about that.
Got
Hesitation, yeah.
Got it. All right, Jake?
Yeah, and obviously I disagree with this part, but one of the things that comes to my mind, I mean, for anybody, let's say if the board has to decide this, um, there's a lot of stuff involved. It's all industrial engineering, how big is the facility, how many steps somebody takes every day, how many phone calls. I mean, it's a complicated study to exactly determine and be fair to the applicant. So another reason, I would steer off of that.
Okay. And Jesse, your hand is up. Oh, you're good.
Sorry,
Okay.
I'll put it
No
down. I
worries.
keep forgetting.
No worries. Renee?
Just a little bit off of what Jig said and what some comments were is, determining like on the facility specific basis, and there were some comments about workload. And I think that that is challenging. I think maybe in a very specific silo of a type of pharmacy, you could possibly look at workload statistics, but for my, and I know this is a lot about community, but in the hospital setting, I mean, some and I think it's the same, but I mean, you can spend a lot of time. There can be something very complex that counts as one, and there can be something very simple that counts as one. So I'm not really sure, like, like in workload statistics, even that would, like that equation, I'm not sure we could exactly come up with that would be in agreement, and really demonstrate what's needed. Also, I think we can all agree that pharmacy workload varies. You can have a very busy day come out of nowhere. You can have a quieter day the following day. So I'm not sure how, like in terms of, well, again, we talked about PIC, but I'm just talking about workload. Just very challenging to base it maybe on that.
All right. Thank you, Renee. Great thoughts. Okay, I think we're ready for some public comments. So, moderator, if you can open the public comment for this question, if any opportunity for the board to have a flexibility in the authority to approve a higher ratio on a facility-specific basis.
This is the moderator. The Q&A is open. The instructions are on the screen for your reference. If you're logged in and would like to participate, click on the question mark inside of the square, type comment in the text box provided, and make sure it goes to all panelists before clicking the send button. If you called in from a phone, you can press *3 from your phone to raise your virtual hand. We have a request from Stephen Gray. Stephen, I'm going to send a request to unmute your microphone. Request has been sent.
Thank you. Let me just say that I've had some experience working with many boards of pharmacy over the past 40 years, and every once in a while, someone makes a suggestion, and I completely understand the suggestion, and on the surface, it looks pretty good, and it looks like a way to determine. But every single board of pharmacy that has had something like this has ended up abandoning it eventually, and there are unforeseen complications. So everything that Member Patel and Renee said is very true. It's very complex. It's very hard to determine. But what also I've seen is something you may not have thought of. As the membership of the board changes, as the staff changes, the judgment about what's appropriate changes. And then someone who was denied comes forward and says, oh, well, how come you let organization X when you denied it for me and my organization? And so then it goes back and forth. And then there have even been lawsuits generated against the boards of pharmacy because of alleged bias or not consideration. Also, it's complex. I mean, what are you going to base it on? Only the testimony? Are you going to agendize everyone of these requests so that the proposer that wants a higher ratio comes in, and then everybody that's opposed to that particular organization, whether it be a chain or a hospital or whatever, gets a chance to come in and provide testimony of why it should not be done. And then everybody who wants theirs done, the next board meeting comes in and testifies. It gets very complex. What I've seen a couple of boards of pharmacy do for things like this is they have a thing where they eventually decide not to go through all of that and they put it on the consent agenda. And once it goes on the consent agenda, every request just gets approved. So what's the point? And so I would really suggest you really consider this very carefully before you go down that road. However, I believe that more technicians to do those things that are listed in the regulation as technician duties would very well serve the public, and it would very well serve the complexity and reduce for most staff their workload and stress. Thank you.
Thank you for the comments, Dr. Gray.
Individual identified as John Gray. John, I'm going to send a request to unmute your microphone.
Hi, good morning. This is John Gray. I'm a registered pharmacist with Kaiser Permanente. This is a little bit tangential to the question that's written in the agenda, but it came up during discussion of this agenda item. So I just want to echo Board Member Barker's concerns about establishing maximum thresholds for the number of tasks that a pharmacist can perform in a given period of time. We are skeptical that the board can be fully aware of the range of tools, technologies, and people that may be available in a particular pharmacy to assist the pharmacist. And so that leads us to be skeptical that the board would be appropriately equipped to establish reasonable thresholds. It's another example of the failure of central planning in essentially all elements of conducting business. So we would strongly discourage the board from walking down that path. Thank you very much for the opportunity to provide comment.
Thank you for the comments, Dr. Gray.
Moderator, no additional requests. Would you like me to close the Q&A?
Yes, please. Thank you, Elizabeth. All right. We have a little, I think it's 11:50. We're just going to plow through here for the last question. Question 4. Do members believe the board should have the authority to increase the ratio via regulation as part of the rulemaking process? For me, this is maybe a little bit easier path with a better flexibility. So this can probably have a little better, I know regulation is not always easy either, but I think that at least this opens a little bit of a door for more formal rulemaking process. So your thoughts on this, members?
So I had a question. So
Yeah.
could you shed light on the two paths a little bit?
Two paths.
One is the regulation and
Another
the
path
other
would
would be?
be us sponsoring a statutory proposal that would have that specific set of, just like how remote process discussion, there could be a very specific set of statutory proposal that would be sponsored and processed through legislation, or that the board could have more of a regulatory authority, just like how the inpatient hospital kind of has their authority, but the board can have a little more of a regulation to change the currently allowed ratio with a ceiling and the floor. So that's my understanding. I'm probably not saying it eloquently, as eloquently could be said by Anne or Corinne, but anyway. Feel free to jump in, Anne.
I think you did a great job. I think the concept, Jig, is that right now you do not have the authority to increase the ratio at all. So as you're considering whether or not changes should be made through the regulation process, it may allow the board some flexibility. You would not be doing it potentially on a facility basis, like with the prior question was getting to. It's just another potential way that if you believe there's changes that could be made through the regulation process, is just another option for you all to consider as a potential way to, facilitate changes. And it would be through the regulation process that you might be making the decisions, right? If it's I don't know, I'm just going based on comments that we've seen today. So please don't know that I'm not recommending anything. I'm just saying, for example, you could say that, for long-term care or closed door pharmacies, the ratio could be up to blah, as determined by the PSC, whatever. But so you could do it, but it would be a more formal rulemaking, right? Where you have general rules of application that everyone follows. Whereas the prior question, the prior policy question was more, you're making a decision on a case by case basis through potentially established guidelines. I don't know if that helped, but I tried.
That does, yes. Thank you. Thank you for shedding light on that.
Thank you, Jake. I know, Jason, your hand was raised, but you put it down. Are you good, Jason?
Sorry, I had to go and close the door. I think that for this item, yeah, if the board could go and get this authority, that would be great. We do need action from the legislature. I think overall, I really am in support of what Jesse had mentioned earlier. Let's hear from the pharmacists. Certainly want to hear about that before moving forward on anything. And of course, we also have the impacts of AB 1286. So it's good that the board is considering this issue now. But I think all of that feedback would be helpful in informing our decision.
Sounds good. And Jesse?
Yeah, I think, comparatively to the remote processing discussion, that discussion was definitely had more of a sense of urgency, I think, attached to it, especially considering the implementation of AB 1286 beginning in January. And so I'm glad we're having this discussion. I am concerned that if we bring a second piece to the board or to the legislature rather, of trying to make this available to the board via regulation, that there may be it may be more difficult for us to get that approval for remote processing. And considering that urgency, I would probably want to keep them separate. But still looking forward to hopefully just talking about a survey or some way that we can reach out to our pharmacists to figure out what the full picture is of the people who are working in various settings.
Thank you, Jesse. All right. Any other comments before I open up for public comment? Okay, moderator Elizabeth, please open the line for public comment. On question 4, on the regulatory authority to increase the ratio via regulation as part of the rulemaking process.
Moderator, I wanted to double check with Jessica Crowley. You have your hand up?
Sorry, I'll put it down.
No worries. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click on the question mark, type comment, send it to all panelists. If you're calling in, press *3 to raise your hand. Stephen Gray, going to send a request to unmute your microphone. Request has been sent.
Thank you again. I would strongly recommend that the board sponsor legislation to take the restriction out of the statute. Right now, as was mentioned in 4115 of the Business and Professions Code, the board does not have the authority to set the ratios in an outpatient environment. It does have that authority to set ratios in hospitals by regulation. So, 4115 was adopted over 2 decades ago. A lot has happened since then. I don't think the legislator would mind at all if that was removed from their responsibility. They depend on the board, who are the professionals that regulate the professional, to get into the details and analyze things like this. So I think that it would probably pass very easily that responsibility and that power onto the board. I would encourage you to do so promptly. Again, it's going to take a year or so before that would go into effect. And so then you would be ready to make that determination after you've done your survey and after you've collected that information. You may or may not decide to have a regulation and do it by regulation, but at least you ought to have that authority if that's what you end up doing. Just another comment, there's been a comment that there's a technician shortage. May not realize that a healthcare minimum wage bill was passed, and that may have a significant effect on whether there's a technician shortage or not, as the minimum wage for healthcare workers will be raised significantly over what some pharmacy technicians are making now. Thank you very much.
Thank you for the comments, Dr. Gray.
This is the moderator. I'm checking for any additional requests. I see no additional requests. Would you like me to close the Q&A?
Yes, please. I see some possible path forward, but I think step one probably is the survey. So maybe it is a good idea for us to bring a survey asking community pharmacists about the ratio, not community pharmacists, I'm sorry, pharmacists about the ratio. And we can ask what the work settings they may be and how they feel about it. Maybe we can bring up the survey for the next meeting, and if we can approve as a committee to distribute, so we can continue the discussion on this issue. I don't know, Anne, do we need a motion to have that formalized? Corinne, I would put that on the spot for you. Or can we, if this is just an idea, that we can just kind of press forward and bring it up for the next meeting, and then we can approve it then.
So
Anne
I'll
or
just-
Corinne, go ahead, either one. Sorry, don't mean to put both. You
Nope,
can
that's
all
okay.
speak
I'll
at the
just
same time.
boldly jump in. This is Anne. I don't think that a motion is necessary. I think it's fine if you want to do one, but I think staff can also just take the direction from the committee and work to develop something, because it's going to come back to this committee for further
Right. Well,
consideration and discussion.
Well, I think a motion would be necessary once we're trying to finalize the survey for distribution to the public. So I think at that point we can use the motion. But for today, this is a very early preliminary discussion I wanted to have, gather everyone's thoughts on it. So I don't think the motion's necessary. So with that, members, any final thoughts on it? Before we move on from this lovely topic of ratio, we survived the discussion of ratio somehow. We'll hopefully continue to survive this discussion. Please, any lasting thoughts? Also, anyone, I am curious about this health. It's just side comment. If anyone has any information, if the healthcare minimum wage is relevant to pharmacy work, I would love to know. Anyone has information, please submit to board staff. I'm curious about that myself.
Hey, Sung, this is Jessie. It's my understanding that it's only specific healthcare facilities. So it's my understanding it does not apply to pharmacy, like outpatient pharmacies or community settings. And I think that's one of the areas that really struggles with the technician shortages, just because the wages are significantly lower in those settings comparatively. But if I'm wrong, someone please correct me. That's my understanding of the bill.
No need. I don't want to get stopped by our board council that's discussing non-agendized items. So I just wanted a side comment really quick. If anyone has information, please submit to the board staff. I would really like to know about that. With that, I think we're through this discussion. It's 12:08. Hopefully, I'm sorry that this meeting is running so long today. As expected, there were some juicy topics in there. So we're going to take a lunch break. We'll come back at 1. We'll hopefully be able to have everyone come back at 1, and then we'll continue on with this discussion. So enjoy your lunch, and we'll talk to you at 1 o'clock. We'll be back at 1.